first emerging practice webinar this year in 2022. My name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor working on behalf of the Gender-Based Violence Area of Responsibility. But today I'm also the co-chair of the Regional GBV Working Group. I'm really pleased that this year we have a new also co-chair in 2022, and this is CARE International. So we're really happy to welcome them, and we're looking forward to working with them in 2022. So as in past webinars, we will have everyone on mute throughout the presentation, but we really encourage you to write any questions you might have in the chat. And I'll be monitoring the chat throughout the presentation, and I'll be writing down your questions and saving them for specific speakers. And then also I will group like questions together. We find that this helps cut down on time, but then also enables everyone to get their questions out there for the speaker. So please, if you could write your questions in the chat, I will be monitoring throughout the presentation. Here at the Regional GBV Working Group, we also like to keep our emerging webinar series to 1 hour. So we will try our best to make this 1 hour from 2 to 3 this afternoon. And today's presentation will focus on a project that was actually implemented by the regional GBV AOR team. So this is my team, actually. We don't usually present our own work, but we thought this was interesting as it deals with data. And I know many people have always questioned about the process that we go through in terms of collecting data and then also analyzing data. We're really happy to also be joined by our Global IM Information Officer, Jay. And he was the project lead for this data project. So we'll be hearing from him in a few minutes, and then also two of our colleagues from country level who took part in the project. Verena from Zimbabwe, Verena Bruno, and then also Harriet Adong, who was the previous GBV subcluster coordinator in Mozambique. So they will be joining us a little later on in the presentation to give just a few minutes of some of their thoughts and reflections on the project. I think we will get started. I did forget, if you could please put in, we forgot to put in the registration. If you could put in the chat which country you are calling from or dialing in from, that would be really helpful. This enables us to understand if our invitations are getting out through our various listservs and forums. So we do have your name and your organization, but if you could please put also in the chat the country that you are calling or dialing in from, we would appreciate it, because then it enables us, as I said, to see how far our invitation and listservs are going. So thank you. We do appreciate that. And my colleague Yvonne, who's another team member of ours here in the regional office, will be noting those so that we can continue then to follow up. So thank you very much to start. So I think without further ado, I will start the presentation with a little bit of background information on the project. Then I will hand it over to Jay, as I said, our Global Information Management Officer, who was the lead on this project. And then we will hear from two of our coordinators, and then we'll also have an opportunity to ask any questions about the process. So the objective of the project were two. One was to standardize GBV data collection and analysis. We focused on 6 countries because those countries are in East and Southern Africa. They have active cluster systems and therefore are led ideally by a GBV subcluster coordinator. And then the second objective of this project was to see how we could generate regional trends. And we know that our field and in our sector that a lot of our vulnerabilities and risks now are beyond borders. And so we wanted to see if we could also look at some of these regional trends so that we could do better advocacy, but then it would also strengthen coordination at country level and ideally programming as well. There were 4 key outputs to the project. One was a systematic GBV information mapping. The second one was a standardized data collection toolkit. And we will talk more about that as the presentation continues. One of the third outputs was the rollout of a strategic minimum standards. And this one was sort of an added output for us. And Jay's going to explain a little bit more why that is, why we incorporated these minimum standards. And then lastly, we're really pleased that today we're also going to be able to launch, or you'll get the first vision of our regional dashboard, which is where all of this information will be contained, and you'll be able to easily access it at any time, so that if you need also information, you'll be able to access our regional dashboard on behalf of the Regional GBV Working Group for East and Southern Africa. So note that much of the information that we are talking about today will be included in the dashboard, which you'll have access to in just a couple weeks once we finalize all of it. Next slide, please. So just a quick project overview. As I said, it was implemented by the regional GBV AOR team in 6 countries that have active GBV subclusters led by UNFPA. This was done for practical reasons. We are based at UNFPA, so we were able to easily transmit the funds for the project. And then also we wanted to make sure that there was a structured coordination mechanism in place in which to implement the project. So this isn't a UNFPA project, it's a GBV subcluster project. In our view, it was a way for us to strengthen our subclusters at country level to collect and then analyze and then use the data. We were very fortunate that the Swedish Development Corporation, or SDC, financed the project. And so everything that we talk about today was with a budget of approximately $70,000 US. And it was a big undertaking, but we're really thankful to SDC for their commitment on data, and hopefully we'll be able to push this forward as well. And then the project was really launched because we did have feedback at field level that we needed to strengthen. There was a lack of data, but then the data we did have wasn't necessarily quality data. And so that led us to two also main reflections. So it was about mapping and sourcing secondary and primary data was not systematic across these 6 countries. And then also we realized that often our methodologies lacked quality and did not always reflect women's voices. And this is really centered around the H&O HRP period, the Humanitarian Needs Overview and the Humanitarian Response Plan. And you'll see for our timeline, we had a specific timeline for this project because we wanted to launch the project to the run-up of the H&O, the Humanitarian Needs Overview HRP period. And so we thought, and this is one of our lessons learned too that we'll discuss later, we thought if we had a 3-month period to collect data systematically, it would also inform our Humanitarian Needs Overview and our Humanitarian Response Plans. And we wouldn't be chained necessarily to the OCHA deadlines, that we would have more, we would have greater flexibility in terms of collecting data. And I think Jay and I will agree, we were partly successful. And then also there was lots of challenges with some of our timeline. So just very quickly, in June, we started mapping the gaps that we saw in terms of information management. In July, we reached out to each of our countries in order to do some work planning. August, September, So we had 2 months approximately to do the data collection. And again, we did that purposely so that we would fit into the H&O HRP period. We wanted real-time up-to-date data. And then we took an additional few months to do data analysis. So when we projected this project or we promoted this project with SDC, we had in our heads it would take 3 months total. And so this is another lesson learned that we'll talk about a little bit later in terms of our timeline. Next slide. It's SDC, which is Swiss. Yeah. And I'm going to hand it over to Jay, who is, as I said, the lead of the project, and he'll take you through really the process and the framework of how we went through each of those steps. Over to you, Jay.
Thanks, Jessica. So following the concept of really to map what's the information management gaps in the region, we relied firstly on an analysis done at the global GBV LR level, as led by my colleague Rafand Halaf. In this analysis, we looked at all the H&O HRP documents and set up indicators to monitor and assess the GBV analysis quality by some indicators. As we zoom in on this region, you can see on the highlighted area in indicator 5, where we want to understand how GBV needs analysis are evidenced by different sorts of information types. We looked at if people are using GBV IMS, if they're using national prevalence data, if they are collecting sector-led assessment or other data. And what's surprising to us is although these H&O documents are often really high quality, but a lot of the clusters aren't able to use their sector-led assessment, for example, safety audits or key informant interviews on needs, etc., to inform H&O. What's also worth noting is not every country, actually most of the countries in the region don't have GBV IMS in place. So it will be difficult for us to understand the trends just by always referring back to that system, which is non-existent. But for us to understand how we can better understand GBV in trends, we all know that incidence or prevalence in emergencies are not the only indication of women's needs. So we use the opportunity of this particular initiative to explore with the 6 countries in the region what indicators or data will be meaningful for us to monitor as the regional trends beyond incidents, and what types of indicators or qualitative questions will be useful for us to standardize so that we use not only the same type of questions and tools, but also follow similar processes so as to enable a regional analysis that is comparable across the 6 countries. This slide aims to take you through what we did in the first phases of planning. I just go through the subheadings quickly. So the first, as Jessica referred to, we understood from field that there's a gap in a systematic assessment planning. And behind this is, of course, a mix of the constraints of resources and time pressure. You all know how busy all the clusters on ground are. And there is usually insufficient longer-term assessment planning. For example, when do you do FGDs for safety audits? Or do we need to expand on our service mapping? How regularly? So these are all dependent on context and not systematic. So we included all the 6 countries to join us in a common standardized information gap mapping using the spreadsheet I'm going to introduce in the next slide. And also we encouraged all 6 countries to use the same secondary data review template, which outlines areas of information that each of the operations should at least look into. For example, the laws and policies around GBV and how that influences women in crisis and their, for example, GBV reporting in legal aspects, for example. So on the right side, we standardize data collection tools, which involves, for example, focus group questions, scheme format interviews. What are the minimum information we want our field teams to collect and analyze later? We also standardize some guidance so that the practice is quality. You may also wonder, there are so many areas of information needed to understand GBV. Then how do we go about comparing those across 6 countries with so diverse context? We have tested the use of a GBV Analytical Framework, which outlines the main information domains for GBV in emergency. So this may look a little daunting, but different color blocks show the different GBV coordinators and IMOs, what areas may have info that inform their needs assessment. For example, in East Africa, there are a lot of climate change related displacement. What kind of conflict and hazard history should we look into? And what indicators to measure about food insecurity and economic degradation? Just for example, you may also saw we put into some efforts in standardizing what we look at in terms of service provision and barriers and threats, vulnerabilities, etc. The process, though systematic, is really time consuming. And you will already see that this is a huge undertaking. And in the end, although we try to provide assistance to all busy field teams, not everybody has been able to complete all the mapping. However, in this table, we are showing you after the mapping, each of the ground teams has decided based on their mapping, different sorts of data collection tools that I think will best fit the needs of their current operation and planning. So I'm gonna just highlight on the diversity of different assessment. And you'll see that, for example, in Burundi, they have opted to prioritize secondary data review and safety audits plus needs assessment for 6 districts. But the reason they didn't use the fund to do service mapping and incident report systems is, one, because they may have already had something in place, or they don't think that's a gap for them for the current year. But you will already notice what's common across the 6 countries is we all agreed to test the collection of cluster level minimum standards for GBV, prevention and response. And this really enabled us to establish a trend analysis and comparison of how we are doing as clusters. And this will be highlighted also in the dashboard later. But in conclusion, the data collection was tailored to field needs, but in the same time trying to establish some common information areas for us to compare. We are now gonna dive into the implementation and some country examples for you to have a more concrete feel of what has been done. So in the previous table, you see every country adopted different planning for assessments in different types. But in the end, in our analysis, only 60% of those were carried out due to field constraints. And on top of the list of implementation, all the countries who proposed to service mapping, they have completed it and found it useful for planning. and around 75% of the proposed safety audits and needs assessment were carried out. Whereas in SDRs, although we have encouraged all 6 countries to complete the SDR using the template, but only 1 out of the 6 was able to really complete the whole review. And then this really brings to us a great reflection of whether these global priorities of secondary data review has a disconnect with how the field operates. And if there's a disconnection of priority, how do we best guide them and assist them? And because of this initiative, we also had some learning in the end to share with you. But all in all, I'll stop talking for a while and really invite 2 of our great success countries, Mozambique and Zimbabwe, to share with us how the data initiative has assisted them in the needs assessment in their context. And if I may now, first welcome the team from Zimbabwe, and the coordinator, Verena Bruno, has kindly agreed to join us and share. Verena, over to you.
Thank you, Jay, and good morning, good afternoon, and good evening, everyone. It's so great to be here with you. I hope you can hear me well. I'm going to present briefly on the GBV community-based surveillance, which is one project that we have carried on in Zimbabwe as part of the Harmonized ESA countries data collection project. So the GBV community-based surveillance is a system to identify GBV cases. So it's an incident reporting system that is managed by community cadres that are called behavior change facilitators. So these are recognized community volunteers in their communities that are trained on integrated GBV SRH awareness and the referrals. So they go into their communities to raise awareness on where the services are and how they can be reached. The community-based surveillance system, thanks to the support to the GBV AUR at regional and the global level, was then adapted in a digital version. So what we did is we looked at the existing questionnaires. So we had questionnaires both for the identification of GBV cases during the community outreach, and also questionnaires that are more related to safety audits, which are also still within the pilot phase. These were originally utilized on a paper-based level, and they were then integrated in a smartphone-based application, very simple application. And we trained a small number of behavior change facilitators in 2 districts. So we targeted for the pilot Chimanimani and Chipinge, which are the 2 districts mostly affected by Cyclone Idai in 2019. So we trained them on the utilization of the system through the application. We supported them with the smartphones, and we supported them with the collection of information from the ward and the community level up to the district and provincial level. So the success about this project is, of course, shortening the period for the referral of those GBV survivors who decide to disclose directly to the BCS. There is a function in the system that alerts directly. It's an alert function that alerts directly service providers, which BCS work very closely with in the remote and hard to reach areas. So we're looking at not only the hotline, the GBV hotline, but also mobile one-stop center, teams, and the static one-stop centers and the GBV shelters in their areas. So this alert connects directly the service providers with the survivor and shortens the time to access life-saving services, and also reduces the double reporting of the case from the survivor. It is very at the pilot level, but it is one of the successes that we managed to carry on as part of the ESA project. And we're looking forward to expand the project in 2022. And in the next, as part of the strengthening the data collection and coordination for the referral pathway within the GBV subcluster in Zimbabwe. I'll pause it here. Thank you very much. Over to you, Jay.
Thank you, Verena. And I think everybody would agree with me. This is an amazing project that really looks at enhancing the efficiency of referrals and also strengthening community level safety audit. So thanks for sharing with us, and we look forward to your next phase of implementation. We'll also now go to another case study on qualitative data analysis, which is also exciting. And I'm gonna pass over to my colleague, Harriet Adon from Mozambique.
Hello, everyone. I'm just excited to see all of you. From Mozambique, we had a mixed method GBV qualitative data analysis. And why we chose this is because it helped us to systematically bring out the GBV needs, the GBV risks, and how we can be able to address that. And we did this by ensuring that we have a systematical use of the software MaxQDA. And I must tell you that because we don't have an active GBV information management system in Mozambique, it kind of filled the gap that that we have, especially in helping us understand the trends of incidences in the field by analyzing the different documents that spoke to the different incidences of GBV in the field. For example, how many documents spelled out that there was sexual violence or there was intimate partner violence. And by that, we're able to see which incidence was highest and which ones need redress most. Of course, we know all incidences need redress. And then some of the successes that we had especially was that there was systematic analysis of 32 partner safety audits using this software. So partners were able to, we were able to analyze all the safety audits conducted by partners, all the focus group discussions held, the key informants, the reports, protection monitoring reports, and hotline users. So in all the 6 districts that were accessible at that time. And also, it was a capacity building session for our office, for the country office, because we were able to actually have one-on-one sessions with the global IM and give us more feedback on that. And not only that, but also for partners as well, being able to have continued support of partners. Now, the impact of this, I tell you that it helps us to prioritize investment in community security mechanisms, helping us to understand how much and how well our safe spaces need to be, and what are those services for women and girls, especially that the tool was able to help us fish out what needs the ladies and young girls we're talking about. Also, the subcluster strategy and work planning provided us with, this tool actually provided us with what we need to focus on for 2022. And also it strengthened our coordination with partners, because all this work that we did was a collective effort of all GBV AOR partners. And we are truly grateful for that. You can be able to see that it was able to quantify the GBV needs. It was able to quantify the risks as well. Thank you so much. Over to you, Jay.
Thank you, and a huge thanks to the team in Mozambique, who has really done so much to push forward this analysis. And we're really excited to see that the analysis came through and there are some fruitful impacts to you. Thank you, Harriet. So in our timeline, we will be now looking at the final stage of the project, which is done in October to December last year. In this phase, last phase, but not the least, we spend a lot of effort in establishing ways of analyzing the collected data to guide our trends analysis, if any. And also, we have through the phase of analysis support, we facilitated a technical webinar on Max QDA for all the countries involved, so that going forward they'll be able to also analyze their FGDs, key informant interviews in a more systematic and technical technology assisted ways. As an output, in addition to country level analysis, there are also two key areas we would like to mention. So first is the GBV minimum standards indicators monitoring at regional level. We have successfully collected six or seven indicators from the 16 standards. And Jessica can also reinforce that point of the importance of monitoring minimum standards across humanitarian settings for GBV. And secondly, we also were able to establish a dashboard that summarizes the GBV people in need, cluster targets, some funding data, qualitative quotes from the field so that people can already triangulate with not just the quantitative, but also what's happening on ground in narrative. We also provided some analysis through interagency partners, for example, on displacement and on conflict and climate change impacts to women and girls in figures. And these are all summarized in our regional dashboard, which I will be showing you on screen now. I think I will need to stop sharing and then reshare. One moment.
Thanks, Jay. While you're doing that, I just want to reinforce that the GBV minimum interagency minimum standards can be found on our website, the gbvaor.net. There are 16 of them, but for this purpose, and maybe not to overwhelm our colleagues at a country level as well, although they may be working towards all 16 of those minimum standards, and in some instances surpassing them, which is the goal. For our purposes, we wanted to start monitoring and reporting on them, just 6 of them, so that we could make it a little bit more realistic, I think, from our end. And I'll turn it back over to you, Jay.
Thank you. Jessica, can you tell me if you're seeing my screen on dashboard?
Yes, I am. And maybe you could just go through those minimum standards that we'll be reporting on every quarter as well.
Great. Awesome. So continue on minimum standards. This dashboard is established to let us know by country. For example, if you want to see Burundi, when you click onto the map, down below, you'll see Burundi having 3 bars in the graph. So the first bar correlates to standard for healthcare for GBV survivors. The indicator used across the 6 countries is a percentage of targeted locations in HRP that are with health facilities staffed with trained clinical workers on CMR. So you see 67% of all the targeted regions have that. So it's an indication on our performance or standard implementation for healthcare for survivors. But wow, when you look at the 16, you may be surprised that there's a drop in standard 6, which is a monitoring indicator for GBV case management. So this allows you to see, okay, so in Burundi, maybe we may need to strengthen or invest more so that all the targeted locations will have case managers trained with the guiding principles and all the series of trainings that are required. But good news is you'll be also very happy to see promising results, for example, from referral systems across all the targeted area being 100% implemented. So this dashboard really is also a reminder for all the practitioners to withhold what we committed to the affected population in GBV response through these standards. The second page of the dashboard aims to provide something qualitative. So here we summarizes in narrative some of the interagency trends. For example, for climate change related issues for women and girls, displacement caused by conflicts, and also what we find in a displacement tracking matrix in correlation to GBV. One quote to highlight maybe, for example, is there's a story from, there's a quote from Zimbabwe from a 26-year-old GBV survivor describing how the services has really helped her reestablish her life with the PEP service, the PSS, and also the mobile one-stop center, etc. So this page also leads you to different operations to their HR info country page, where you'll be able to find even more needs assessment that's already done, and also their country level monitoring of their responses, etc. This one from Somalia. So I'll stop sharing the dashboard and then come back to our final part of the presentation. I'll hand over to Jessica to share some of the successes and challenges and ways of improvement as suggested by the participating countries.
Great, thank you, Jay. So of course we wanted to evaluate. As you saw, each country did the implementation slightly different and used each country approximately had about $10,000 US to spend on this initiative. And so in some countries, they use that to finance a local women's organization to do the data collection in terms of buying fuel and tablets if needed. We really wanted to encourage the use of technology where appropriate. And you saw in Zimbabwe, those phones were bought through the project so that they could enter the data through the phones. So every country looked a bit different. And we wanted to make sure, obviously, that we were standardizing as well. So 75% of our participants, so each over those 6 countries, thought the initiative was useful in their country, for their country, which we consider a success. And then 100% think that the initiative responded to the gaps identified according to field needs. And so that was really important for us because that speaks to our first 2 steps. The one, which is the GBV IM mapping, which we looked at needs and gaps. And then the second one that we appropriately planned to meet those needs. So that second figure we were really happy about as well. And then lastly, as I said, we initially started this project to help inform the H&O HRP. And 70% of our countries said that the initiative reduced their stress around tight HPC timelines. And you can see there are some other areas of improvement as well. And so some of the things that were mentioned in areas of improvement were the budget. And we specifically, well, first we didn't have, a full-scale budget, but we didn't also want to have, a really comprehensive budget. This was just to kind of push some of our colleagues at country level, because this is the mandate of GBV subclusters at country level to collect data. And so they are doing it. We just wanted it to do it in a more systematic way, as we said, so that we could look at regional trends. we also recognize that coordination in time, it was difficult to see this throughout the timeline. And then also standardizing methods and tools to allow comparisons of findings. So those were, we did do a survey at the end. So that brings us to what some of our successes were. An unintended success for us was the monitoring of the GBV minimum standards. As you saw from the chart or the table that Jay put together, and this is something we didn't anticipate. So we had some, I guess, things that we thought how this project would go. And during that table, I think where they presented all of the different tools, we realized that each country was at a different place in terms of information data collection. So in order for us to look at regional trends, each country would have to do the same exact sort of implementation. And we weren't getting that in the beginning. And this is why we introduced the minimum GBV, the minimum standards, 6 of those indicators, because we know that each country would have to report on those eventually. And so that was an unintended success and one we're really happy about. And obviously you saw in the dashboard that we will be monitoring those every quarter. The second, of course, is our regional dashboard. We hope that everyone on this call and throughout the greater community will look to that as a resource to find data and trends in East and Southern Africa, most specifically on those countries that have active clusters. And then, of course, the increased capacity to analyze qualitative data. As you saw, as part of the budget for the project, we did buy the licensing for the software for the, and we provided technical support for those that wanted to in order to utilize the software so that we could quantify qualitative data. And that's what we also wanted. As many of you know, in the GBV sector, we do a lot of qualitative data collection. And so we were looking for ways in a way that we could quantify some of all of that qualitative data. And this is why we also introduced the software package. And we're going to be looking throughout 2022 to see how we can better do that. And then the lessons. So a lot of our country colleagues felt like the timeline was too short. And that made us reflect. Because we are in emergencies, of course, we don't always have the luxury of time to collect and analyze data. And we get this a lot from our donor community. So I think this is going to be one of our lessons, but also a reflection for us. And I think this is really important and also reinforces the need for us to standardize how we do these things. And then, of course, another lesson is, of course, the insufficient IM or information management and HR capacity. And so I think Harriet mentioned that we didn't have a full-time, for instance, IM in Mozambique. We were really fortunate to have the UNFPA's IM, who was, triple hatting, basically help us implement portions of this. But ideally, we should have a full-time IM working on behalf of this GBV subcluster in each of our active cluster countries. And so again, a good lesson, and we're going to take this as an advocacy point because we have a whole project that reinforces it to our donors, that we need to have that. And then lastly, another lesson I think that came out of this is we need to have better IM planning so that we can meet these timelines in a way that's useful. So moving forward, how will this look moving forward? Well, first, we're going to finalize the regional standardized data collection toolkit. So I saw some questions about how, some of the tools we used. We have a new IM, a regional IM specialist who will be joining us in another month or so. And so we were really, really fortunate. Can't say enough about Jay's contributions to this project because he really did lead it. And so now we'll have someone taking over in the next month or two. And this will be obviously part of the focus of their work, is finalizing the toolkit. And since we are all interagency, this is going to be open to everyone. And then again, and the next thing moving forward is looking at that regional dashboard. Oh, sorry, I'm going to come back to that other point because I didn't look at service mapping and safety audits. So in terms of what we're able to look at in trends, right now, our main output is looking at the minimum standard indicators, creating trends on, as Jay said. But we noticed that if the two primary data collection tools that are used at country level are service mapping, which makes sense, that's one of our core business, but then also safety audits. So when our new IM specialist comes on, we're also going to go back to each of those 6 countries and collect the data from the safety audits to see if we can also look at the trends from that. And then hopefully we'll be able to look at safety audit trends as well. And then ideally in the second half of 2022, make sure everybody's using the same tool. In order for us to generate these trends, we have to make sure that we have, uniform data, obviously. And that brings us to the dashboard, which again, we've talked about. And we'll be uploading as we go and learning and evolving from this. So please, as I said, the dashboard will be will be on our regional page, which is on the gbvaor.net webpage, the global page. And this dashboard is a result of the regional GBV working group for East and Southern Africa. So it's really a compilation of all of our partners. And then lastly, systematic GBV related information collection. As I said, we want to deep dive a little bit more into the secondary data reviews, because as a result of this study, we learned that those aren't as utilized or implemented as much as we like. They're considered a priority for us at global level, but we're maybe not seeing the same emphasis at country level. And so we'll want to know why and see how we can better meet the needs of our country level colleagues in terms of moving forward. Great. So I think we'll stop here. And I know that we have some questions. So let me, Jay, I think I'll go to the first one, Jay, if I could. And if other people have questions, please do write them in the chat. I've written down a few. We have about 10 minutes left, and I think that's a nice amount of time for the questions that I've called here. So Jay, a few questions about the minimum standards, and I saw Evangeline, you have one as well. So Marina had asked about the minimum standards. Are there standardized data collection tools that we're using to report or to when we're reporting on these indicators? And the second question was, do we have any good practice or lessons learned? And I have an addendum to that one. And then Evangeline has just put in the chat, how were the minimum GBV standards arrived at? How were the monitoring of the GBV minimum standards arrived at? And maybe we can go through that process, because we did have a process of each of the countries selecting 6. And so Jay, the 2 questions from 2 different participants, one about the tools we're using to actually monitor implementation of those minimum standards. Do we have any good practice or lessons learned yet? And then the third is also looking at monitoring. Over to you, Jay.
Great. I'll start with answering the tool as a good practice for monitoring cluster level minimum standards. So in the global global GBV AOR, there is a task team who is leading the development of minimum standards indicators under a very thoroughly reviewed framework. And I think it will be concluding its review in a few months' time and be published across the partners. And in that framework, the global team has been keen to collaborate on reviewing the cluster level indicators. And that also compares what we are measuring as a pilot here in East Africa using this initiative. And then with that very standardized task team developed framework, we were able to put in some metadata, which describes how you monitor different and qualifies different progress in a traffic light system. So we look forward to the finalization of that, and then the GBVOR community is also leading and finalizing that. So our effort feeds into that. That would be the best practice. And secondly, how did we measure all the indicators, right, throughout these 6 countries? So before the task team at the global level had started working on that M&E framework for minimum standards at global level, we have engaged all the 6 country IMs and coordinators throughout July to September. And we filtered through the 16 indicators that are proposed under the minimum standards guidance. And we found out that 6 of them are the closest to programming and coordination in these six countries. For example, the healthcare providers training on CMR or the referral pathway coverage. We thought these would be the ones that are nice to start piloting with, since it will be easier to get data from service mapping. Although we did spend a lot of time discussing the metadata and definition, you will already guess that each country wants to define it differently according to their operation and context. But in the later version of this dashboard, we'll be able to provide the metadata and justification of the reporting when you click on the indicator of each country. So you'll have a better understanding of how that is calculated. Over to you, Jessica.
Thank you. And just in terms of good practice and lessons learned, I think we're still at this stage. We just this started in January. So Marina, we hope to gather those, I think is the short answer to that. And hopefully we can have another session like this, at the end of our year to see how we did. And then we'll have more. And Evangeline, you had also asked about district versus country representation. Just to note that Verena is going to actually talk about that in the next question. We chose the 6 countries that were selected. We selected those countries because they are the ones in the East and Southern Africa region that have active subclusters with coordinators. So we selected those based on that because it is that's our kind of our business. And then secondly, the H&O and HRP, if you go to our dashboard and click on each of those countries, you'll see where the focus is. And usually it's dictated by OCHA and others, but there are very specific areas that our coordination mechanisms at country level focus on, and it's usually those that are embroiled in the crisis or conflict. So just to note that as well, if you're interested in more looking at what exactly is the coverage area for each of our subclusters, you'll be able to go onto our dashboard to figure that out. Verena, there were 2 questions for you, and I see a third one here too about the eGBV surveillance system. So I'll put those together, Verena. The first question is, what kind of application did you use for the phone? If, and this I think speaks to Evangeline's question as well, you only rolled it out in 2 districts. Will it be difficult to form cross-country comparisons with such a small catchment area? Those are your 2 questions, Verena. So the first is, what application did you use? And the second one is about representation. Since you rolled it out in 2 districts, is that representative then of country level? Over to you, Verena.
Thank you, Jessica, and thank you to the participants for the questions. So on the type of application, we engaged a consultancy company. So it isn't anything like a fancy application, but it's a very simple way of transferring paper-based questionnaires for the surveillance and the referrals into a digital interface. So we are not yet at the level of having an application that you can find on Google Play or something like that. So yeah, it is a very simple digitalization of the questionnaires at this stage. We are hoping to make it more structured as we move forward. The question on the district versus national, of course, this is a pilot. So with the available resources, we were only able to target the 2 districts, and as I said, we picked it because we picked the districts in line with the context, which is a quite complex recovery situation in the Cyclone Idai affected districts. The comparison at the moment can still happen because the BCFs operate in a number of other districts with the paper-based. So we might not be able to have data at the national level yet, but it will still be interesting to see the comparison between the paper-based and the work with the service providers without the digital alerts and the 2 districts where we have initiated this. I hope this answers the questions. Thank you, over.
It does. Thanks, Verena. And then one add-on question Hilary had was about the eGBV surveillance system. And there's probably no easy answer for this. How can it work in context without or with poor internet connection coverage? Verena, I'm going to put that one back on you.
Yeah, actually, in Zimbabwe, the eGBV surveillance can work without internet. So of course, the data collection can be done without internet, and the dashboard and the data collection at the end of each month is done on a monthly basis, is still working without internet connection. And the alert, we're still exploring different ways of sending the alerts to the service providers. But the alert is not only on an internet-based channel, but also through SMS, for instance. So we're trying to create a double way of doing it, so it doesn't interrupt, the flow of information, especially from the BCFs to the service provider. It is still, to be developed. We are still exploring ways to address the network issues, of course. Over.
Thanks, Verena. And we have 2 minutes left before the end of our hour. And I see that Jennifer Chase, who we're happy to have joining us today because she is our global GBV AOR coordinator at global level. So we're happy to see you on the line, Jennifer. And thanks for this question. Are the indicators from this project the same as the ones at global level? The indicators that we used are from the minimum standards. So yes, we chose 6 instead of 16 because we wanted to make it a bit more, we wanted to ease into the reporting. That doesn't mean that our countries are not meeting or surpassing the other 10 indicators. It just means in terms of reporting, we decided to focus on 6 of those. And I already put in the chat a link to those interagency minimum standards, which we really encourage every organization who is implementing any type of GBV service to get to know and to adapt and promote. So I think we'll end there because we have one more minute. You'll be able to access the dashboard. We're finalizing the data because we are still finalizing HNOs and HRPs in some countries. We didn't want to launch it today, although it is pretty much done. We're just confirming with a couple of countries. We don't want to launch data that's not officially been launched by the global community. So that you please look towards our global website, gbvaor.net. We do have a regional page on that website, and we will be able to send out to you when it is on the online live and make sure that everybody has access to it. Please do use it as a resource. We've put a lot of time and effort into it, and so we would love to see it used heavily, as it were. I would really like to thank everyone for joining us today, specifically Jay. We could not have done this project without you. Verena, Harriet, all of our other GBV subcluster coordinators throughout the region. And most importantly, we'd like to thank our donor, which is the Swiss Development Corps. So Switzerland, thank you for having faith in us in order to look at regional trends and data collection throughout the region. If you have any questions specifically about any of these processes, you can reach out to us here at regional level or to Jay, and we can put you in touch with the right person or resource person. So thanks everyone for joining us, and I hope you have a great afternoon. Please do join us for our next Emerging Practice webinar series, and we hope to have that at the end of March. So thanks everyone. And if you're interested in joining the regional GBV working group for East and Southern Africa, please do reach out to me and I can put you on our mailing list. Thanks everyone and have a great afternoon.
Thank you.